Thanks, Brandis. Early in the program, we discussed voting rights bills, and now we're joined again by Representatives Mike Quigley, Cheri Bustos, and Raja Krishnamoorthi. Again, we've invited all of the Republicans in Illinois' congressional delegation to join our conversation tonight, but none accepted. We do, again, thank you all for joining us here again. And let's start a discussion with COVID. Health officials from the CDC, FDA, and NIH testified on Capitol Hill today about the explosion of Omicron. Please take a look.
I think it's hard to process what's actually happening right now, which is most people are going to get COVID. All right, and what we need to do is make sure the hospitals can still function, transportation, other essential services are not disrupted while this happens.
And Congresswoman Cheri Bustos, do you agree with that sentiment there from Dr. Woodcock that the sentiment now is most people are just going to get COVID?
Well, I worked in healthcare for 10 years of my career, although I worked in communications in healthcare. So certainly I'm not any medical expert. But let me tell you what we're seeing in the congressional district that I represent. It's a mostly rural district, but we have three bigger markets. We have Rockford, Peoria, and the Quad Cities. In Rock Island County, which is where I live, it's only a population of about 140,000. We had 676 cases late last week in 2 days. So we are now to the point where our hospital, one of our hospitals up in Rockford is no longer taking elective surgeries. We have another hospital that every one of the ICU beds is taken up. Look, I worked with so many doctors and nurses over my decade in healthcare, and I still keep in touch with many of them. They are worn out. There's a little bit of this backstory of kind of this, you don't go in healthcare unless you're an empathetic type person. And now there's this talk about an empathy deficit because everybody is just so worn out. And the message is get your vaccination, get your booster, wear your mask, use your hand sanitizer. It is like the basics are all there. And we cannot continue to stress our healthcare system beyond its seams, and that's where we are right now.
And we certainly have heard those same sentiments from healthcare officials in recent weeks. Congressman Krishnamoorthi, part of the Biden plan is to send up to 8 at-home tests to all Americans to have reimbursed by insurance. So when a constituent comes to you and asks you, how do I get my hands on a test and will it be free, what is your answer to them?
The answer is that it will be free and that you will receive these tests. Of course, right now, people are trying to get tests and they're having a hard time, honestly. They're not able to access these rapid tests at their local pharmacies. They're not able to get the PCR tests back quickly enough to make judgments about, whether they should isolate or how do they approach their affairs at work and so forth. And so I think those plans to get tests are going to be very useful, especially as we deal with future variants. Right now, I think the most important thing is, as Cheri alluded to, making sure that you get your vaccinations, get your boosters, and then you isolate and quarantine as necessary. My wife happens to be a physician, and 50% of her patients are COVID positive right now in the hospital. And so this is extremely nerve-wracking for folks, and I think we just have to, at this point, play it safe and make sure that everyone tries to stay out of the hospital, and vaccinations are the best way to do that.
Congressman Quigley, does there need to be more of a federal response beyond just sending tests? For instance, sending more federal assistance to hospitals?
Sure, the hospitals are going to need it. Our caregivers are going to need it. Schools and other institutions are going to need it to put systems in place to protect everyone. But the bottom line is still back to vaccinations. Unvaccinated people are 6 times more likely to test positive, 9 times more likely to be hospitalized, 14 times more likely to die from COVID. So, we're probably going to be with COVID for a long time. And a large part of that reason is the fact that there are still people out there who refuse to be vaccinated.
Congressman Quigley, I'll stick with you here because there are a bunch of Chicago public schools in your congressional district. Do you agree with the mayor and President Biden that those students need to be in school despite the wave of Omicron right now?
They need to be in school, but we need protections in place. Part of that has to do with getting kids vaccinated and putting all the other systems, including screening and protective equipment out there to protect the teachers, the staff, and of course the kids.
And is there more federal assistance on its way for those initiatives?
Well, I don't know exactly where CPS is with the assistance they already got, but we need to make sure they have everything they need to get the job done.
All right, I want to talk a little bit of politics. Congresswoman Cheri Bustos, 24 House Democrats announced they're retiring next year. That you're among those Democrats. Does that say that it's going to be very difficult for Democrats to keep the House?
No, I think it says that, I can speak for myself. I've been in office, it'll be 5 terms by the time I'm done. It'll be 10 years, a full decade. And for me, it's just on to my next chapter. I am not by any means abandoning ship. I'm going to do everything I can to make sure that the seat that I've represented since 2013 is represented by somebody who's great. And we've got some wonderful candidates. And I think as you look at the others, it's either people wanting to move on to their next chapter in life, people who want to spend time with their grandkids, people who want more family time, or people who are just ready for something else. But look, I think I ran the political arm of House Democrats for the previous cycle, and it takes all kinds of strategy to be successful at the ballot box. But I'm confident that we're going to have great candidates running all over this country. And, we just have to gear up for that. We've got, basically about 10-ish months to go before that November election. And, I think we're going to be ready for it.
And Congressman, that is going to be a slightly different district because of some of the redrawn maps there. Congressman Krishnamoorthi, the president's approval ratings aren't very high relatively right now. What do you think Democrats have to do in the next 10 months to make sure that they don't lose the House or the Senate?
Well, I think what we have to do is deliver for the American people. We have to get things done. Obviously, we've been talking about BBB, but as I said the other day, I think we need to get into GGG, get governance going. Whatever components of that particular bill that we can actually pass and get signed into law, whether it's prescription drug price reforms, universal preschool, or expanded child tax credits, we need to get that done because my constituents want it. We also need to tackle inflation and, of course, COVID and the other kitchen table topics that people are discussing every day.
And Congressman Quigley, are there any of those singular components of that Build Back Better bill that have momentum on their own right now?
If I had to read into what the Senate's doing, I'm just not sure. I mean, they're all important to me. I mean, obviously, climate change, the tax credit for kids is going to run out. The child tax credit's going to run out now. This is the last week that's there. That lifted half of America's children out of poverty. That's extraordinarily important. But let me just address what you just asked. The bottom line is we can't be defeatist. There's a lot to talk about. We're still trying to pass Build Back Better, but we passed a generational infrastructure bill, and we're going to start seeing the benefits of that in March as the cranes go up and construction begins on rebuilding our country.
And the debate ramps up now on voting rights, among other things, and we're going to have to leave it there. Our thanks to Representatives Mike Quigley, Cheri Bustos, and Raja Krishnamoorthi. Thanks so much.